Welcome to Insider Med. Today, we're going to talk about a test that you should know about if you or a loved one suffers from epilepsy. It could change the outcome of your management of this disease. Before we get started, remember, this is not medical advice. Please consult your physician for the information necessary to best manage your care. A little background on epilepsy. A seizure is a burst of abnormal electrical activity in the brain that temporarily interrupts normal function. With a seizure and the interrupting of function, it can manifest itself as abnormal motor activity or loss of consciousness or a number of other manifestations. Epilepsy is a brain condition marking one who is susceptible to having recurrent, unprovoked seizures, usually considered to be 2 or more in number. There are many types and causes for seizures in epilepsy, but today I want to focus on genetic factors and a test that might improve outcome in appropriately selected cases. Genetic causes are thought to be contributory for a significant number of individuals suffering from epilepsy. It is estimated that up to 40% of epilepsy cases in children have some genetic factor, and up to a quarter of cases in adults may have a genetic factor. A recent study published in the Journal of American Medical Association Neurology suggested that approximately 50% of individuals with a genetic diagnosis had clinical management changes. So if they did a genetic test and the test came back positive, 50% of those individuals would have a change in their management. Of those, about 3/4 of the treatment changes were associated with improved outcome. And of those with improved outcome, this was found to be reduction or elimination of seizures in about 65%. So putting these numbers all together, bottom line, if a genetic test suggested a factor involving some combination of genes as contributory to the cause of epilepsy, significant improvement was found in a number of cases. Now, the interesting thing is this gene test is available currently through a company called Invitae, and it is called an Invitae Epilepsy Panel. The test code and the link are visible. As a disclosure, I have no financial relationship whatsoever with this company, but this is the test that was used in the study and is clinically available. To make things more interesting, children under 8 years of age with unprovoked seizures might qualify for free testing. There is sponsored testing that is available through Invitae. The link is listed below, and one can apply to see if they qualify. If you do not qualify, then it will be important to check with your insurance to determine what coverage you might or might not have for this test, and Invitae for cost to be expected if you do not have coverage. So what can we conclude? There are currently available genetic tests that can diagnose the basis for epilepsy in a significant number of cases. Interestingly, this test is relatively easy to perform. While it is suggested on the website that blood is the preferred sample, saliva and/or cells from the inside of the cheek can also be used. A substantial number of those individuals where the genetic test indicates a genetic basis for their epilepsy can expect treatment changes, and a significant number of those can expect an improved outcome. It's important to note that even in appropriately selected adults, there might be benefit from this test, both for treatment and for other factors such as risk of offspring inheriting genetic propensities to epilepsy. Again, remember, this is not medical advice. Please contact your epilepsy specialist and ask whether this test could be of benefit to you if you've not been offered it already. That's it for today. Until next time, this has been Insider Med.